from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back into Channel 7 Daybreak. 6:24 is the time. It's hot out there. It hasn't been the last couple of days, but get ready. It's about to be hot again. If you're going to be spending any time outside, of course, sunburn is a concern, but it shouldn't be your only one. It's actually important to think about your heart health during the heat and high humidity, too. Joining us this morning to explain why is Baptist Health cardiologist Dr. Scott Davis. Thank you so much for joining us, Dr. Davis.
Welcome
of course,
back.
we always talk about our skin when we're talking about going outside in the summertime, but I know that heart health is very big. It's something that people think about these days because it's the #1 killer, #1 disease, right?
A lot of this is going to sound like common sense, but boy, we need to emphasize it this time of year. You know, the old line, how about that weather? I mean, it is hot outside. And when temperatures get, north of 90 like they are today
and the next 5
days. And the humidity is also north of 90 where you can cut the air with a knife.
Yeah.
It's just simple. It's basic mechanics, but people need to understand the heart has to work harder to keep the body cool.
Okay.
And so if you have previous heart disease, if you've had a heart attack, you've had a damaged pump, then the pump's going to have to work even that much harder to cool your body. And so we need to do just some really practical tips. Number one, if you're on medicine that helps to either lower your blood pressure or on a diuretic, a water pill, you're going to be more inclined to either having lower blood pressure during these hot summer months, especially outside, and you're also more inclined to be dehydrated. And so we tell people, look, your friend is drinking water, okay, and you need to stay hydrated. And the issue, especially with folks as we get older, is that your thirst mechanism tends to turn off after a few sips. So you drink a little bit of water, go, well, I'm not thirsty anymore, so I don't need to drink anymore. And that's not the case. You really need to be attentive to making sure you drink the full 16-ounce, bottle of water, and understand water is not to be substituted with something else. It's not like, the Diet Coke can substitute for water.
Because it has water in it.
Yeah, it has fluid in it, right? It's not the same thing. And so, beer doesn't substitute, wine doesn't substitute, coffee doesn't substitute, iced tea. Tea actually is a diuretic. So we really want to be attentive to maintaining your volume and then also being sensitive to the medications you're on. Also understand that as we get older, not just if you have heart disease, but then as our seniors, then as you get older, your body's ability to regulate your temperature becomes more of a challenge. And so then you really need to understand that you need to pay attention to symptoms of a heat stroke. So that, like, if you start developing fatigue, if you start getting dizzy, headache, muscle twitching, these are all signs and symptoms of potential heat stroke. And that's something you need to be aware of and not just think, it's going to go away. First thing to do is get inside and get cooled off. But if, despite that, these symptoms persist, that's a call to 911. That's a call to your doctor. So, A, we want to make sure we're sensitive to volume status, and B, let's really pay attention to symptoms this summer.
All right, now, if you experience any of the symptoms, of course, call 911 if you feel like you're having a heat stroke, but you can always call the Baptist Health Healthline if you just want to talk to a doctor and maybe go and get a consultation about those medications or about some of your levels. If you have high or low blood pressure, make sure you get that checked out. Baptist-health.com for more resources. Just go online. They have them available there. And thank you, Dr. Davis, for coming in. Stay cool out there. It's about to get hot again, folks.